স্মিতাকে একবার বলো আসতে বলো। হ্যাঁ, স্টুডেন্টদের সব খাবার তো টেলিফোন করে বলে দেওয়ার জন্য। স্মিতাকে আসতে বলো। স্মিতা রিদি রিদি হ্যাঁ তুমি সব ডাক্তারদের টেলিফোন করে বলে দাও যে আমরা অনলাইনে আছি, আপনারা সবাই অনলাইনে চলে আসুন, ওই আপনাদের এতে ক্লিক করুন, যেভাবে করতে হয় দিদিবা যেভাবে বলে সেভাবে বলে দাও ওদের। আমরা ক্লাস আরম্ভ করছি। Yes, yes. Good afternoon, doctor. Today I will start our second class after the lockdown. So our today's item already I have informed you that first time is the indication what type of machine the gynecologist will purchase, what are the criteria of the machine for the gynecologist, that I will discuss first. Then I will discuss the why ultrasound is necessary for the first trimester pregnancy. Next is actually the indications, and then the normal first trimester pregnancy, normal anatomy of the first trimester pregnancy, then the abnormalities of the first trimester pregnancy. First of all, you all know that gynecologists, ultrasound machine is a very essential tool for the gynecologist. They can use it for their personal practice, as well as they can work as a sonologist. For personal use of the ultrasound machine, the criteria should be modern small type of machine which they can use both in their chamber as well as in their labor room as well as their antenatal ward. So it should be easy to take the machine from one floor to another floor. Normal, the government of India's rule that you cannot move the machine from one place to another place, but you can use that machine in the same premises. So it should be easy to move from one place, one floor to another floor. Secondly, the keyboard should not be very complicated. Our OPD is very congested. So naturally many patient comes in your OPD, so that you can quickly examine the patient. If you can examine the patient very quickly, then it will be easier for you to manage all the patients. So if the keyboard is very complicated, it will be difficult for you to use that machine. Moreover, the machine should be very fast, so that you can use that machine very quickly, you can examine the patient. Thirdly, it should not be very costly machine, so that you can charge less to your patient. And most important thing is that the after sale service which machine you will purchase, the after sale service should be very good. Without after sale service, you cannot use that machine. And the machine should be very much compatible with the weather. In India, we all know that it is a humid country. Moreover, the dust is very much. So for that reason, it should be rather compatible with this atmosphere. So all these things you should think before purchasing the ultrasound machine. So next thing, that in particularly pregnancy, who should be scanned? Who should be scanned? There are many discussions on the gynecological society as well as the radiological society. All of them decided that there should be 3 scans. First scan in the first trimester pregnancy, second scan in the second trimester pregnancy, and third scan in the third trimester pregnancy. So first scan is the first trimester pregnancy, that is up to 12 weeks, and second scan is about 18 to 22 weeks, particularly anomaly scan. And third scan is 33 weeks, 36 weeks to see the growth scan. For that is in growth scan and the presentation, amniotic fluid volume, all these things. So 3 scan is essential in a antenatal care to give the good antenatal care. For that reason, you should have to examine the patient size. Next is what information we generally get from this scan. So in first trimester pregnancy, I will give you in details the indication of first trimester pregnancy. In the second, third trimester pregnancy, the mainly we see the number of fetus. Mainly we see the number of fetus, we calculate the gestational age, we see the live, the presentation, that is the presentation, and mostly the amniotic fluid volume, and also we see the placental attachment, the viability. So these are the things we generally see, and the placental maturity also corresponding to the gestational age of the fetus. So this thing we generally see during the examination. And the bladders should be, particularly in case of first trimester pregnancy, the bladder should be filled up. So without filling the bladder, we cannot see the embryo or fetus in nicely. So bladder should be filled up. So always you tell the patient to come with full bladder. It is easy to evacuate the bladder, but it is not easy. Not easy means it will take time to fill up the bladder. So for that reason, what we need, we ask the patient always to, so that's it. So doctor, now there is some technical problem. For that reason, we are just waiting for a few minutes, few seconds. Huh? এই দীপা তুমি তো এখানে এসে
Evening, sir.
এখানে কি করছো? না অ্যাডমিট অল করতে হবে। অনেকে এখানে ঢুকতে পারছে না।
আগের দিন ঢুকেছিল উনি, আজকে তো আমারটার মধ্যেও আসছে না।
এবার আসবে সবাইকে এখানে মনে মেসেজ আসবে পার্টিসিপেন্ট যেমন 11 আছে তো এখানে মনে মেসেজ আসবে অ্যাডমিট অল বলে।
Doctor, now I hope that all of you can listen. Can you listen, all of you? So, okay. So first of all, so that you have understood what are the need, what type of machine, what the criteria of the machine that you purchase, and why we perform ultrasound in case of pregnancy ultrasound, that you have understood. Now, what is the future, and what is the future of this ultrasound? So you all know that you all know that you all know that that ultrasound is not very old. It is about 60 years old, about, and then 60 it has started. So during that time there is immense development of ultrasound, but still, and because the image we get by the sound wave, so it is not like X-ray. There is no ionizing effect. So, but still the energy, because sound energy, if we use the sound energy for prolonged time, there may be production of heat, particularly the Doppler ultrasound. So in first trimester ultrasound, prolonged use of Doppler ultrasound, this unnecessary use of the Doppler ultrasound, you should avoid it, and because the generation of heat may cause some harm to the embryonic cell. So that is the only thing. Otherwise, there is no other contraindication or no other adverse effect of ultrasound. So future is very bright future, and nowadays the newer technology develops. There are newer different type of invasive method are using, but এখানে admit করে দাও এই হ্যাঁ so newer technologies are coming, particularly in the ultrasound. So doctor, so future is very good, and but the 60 years time is not 60 years is not very long time. Particularly 60 years not a very long time in history. Let us hope that it will be harmless and in the future also. So with this introductory notes, I like to start the first trimester pregnancy. First of all, the indication of the first trimester pregnancy. The indication is most first of to confirm the pregnancy. Though again আরেকজন ঢুকতে চাইছে এই to confirm the first rather pregnancy. Nowadays our human gonadotrophic gonadotrophin is very gonadotrophin is very easy to see even after এই জায়গাটাতে বসুন So even in the after the after the gestation age of the first week of the gestation, so even first week of gestation, the first week of gestation, patient can easily you can easily diagnose the pregnancy. But for ultrasound to detect the pregnancy in ultrasound, the gestational sac is important. Though 0 to 4 weeks, there are some changes in the uterus. There are some changes in the uterus. That is, some uterus is slightly bulky, small amount of fluid is in the uterine cavity. Small amount of fluid is in the uterine cavity. So what we need at the end of 4 to 5 weeks, we see the gestational sac, and gestational sac with a bright echogenic line outside that covering the sac, which we call this which we call the your echogenic, which is called your weight, that is the echogenic ring. Okay. So that the your echogenic ring we get, echogenic sac we get first of all, and with a bright echo, that is decidual reaction. We get the decidual reaction. Then we get the first appears the yolk sac. In 4 to 5 weeks, then 5 to 6 weeks. At 6 weeks we get first yolk sac. Then we get the fetal pole. So naturally when we get the gestational sac with decidual reaction and the yolk sac, that is the 100% confirmation of the pregnancy. That is when you confirm the pregnancy. Next when we get the fetal pole, when we get the fetal pole, then naturally we have to see the viability, that is the cardiac pulsation at 6 to 7 weeks at least, and particularly here we are performing ultrasound in the transabdominal type. And in your program it is a transabdominal ultrasound. But in case of transvaginal ultrasound, the little bit 1 inch earlier we can see the cardiac pulsation. But particularly when there is cardiac pulsation, that you can diagnose that the embryo is viable. So the obstetrician, they can't see, they can hear, or they cannot see the cardiac pulsation. Only the sonologist, they can see the pulsation. So they can confirm that the embryo is viable. Particularly in case of the early breathing PV, the obstetrician, they are in the very dark. They don't know whether the embryo is viable or not. But by ultrasound, they can see the viability of the embryo, and they can confirm that this is a viable embryo. So they confirm the viability of the embryo in the first trimester pregnancy. Is a very important indication of ultrasound. Next is that whether the gestation is within the uterus or outside the uterus, in or out. If the pregnancy is within the uterus, then it is all right. But sometimes the pregnancy may be outside the uterus. So which is called ectopic pregnancy. That is very dangerous. So it will be life-threatening complication. So for that reason, that only by ultrasound in the early stage, only by ultrasound with the early stage, you can confirm that it is an ectopic pregnancy. And that is when you cannot, when the pregnancy test is positive, but within the uterus, you can't see any gestational sac, or you can see only the pseudo-gestational sac. Pseudo-gestational sac, which is, there is no residual reaction. There is no residual reaction, only a sac-like substance you can see. That is not, and it may not be it may be central, if it is, but the actual gestational sac, it may be eccentric also. So to rule out ectopic pregnancy is one of the most important indication of your ultrasound in the early pregnancy. Next is the gestational age, confirmation of the gestational age. There are different conditions where the gestational age cannot be calculated. That's because particularly the history of taking oral contraceptive drugs, history of the patient is a lactating mother. So if the baby is taking, there is no date, menstruation, and there may not be any, that there may be postpartum pregnancy, that may be there is so wrong date. Patient don't know the exact date. So irregular menstruation. For all these things, you cannot calculate the gestational age. So, but by ultrasound, it is very easy. It is very easy. It is very easy to determine the gestational age. To determine the gestational age by ultrasound. So by gestation, even in the early stage, when from the sac, you can determine the gestational age, and from the embryo by the CRL, you can determine the gestational age. So calculation of the gestational age, you can easily perform, easily calculate the gestational age by gestational sac and by the gestational sac. So next indication in the first trimester pregnancy, that previous complication, if there is any previous complication to pregnancy, that is your cesarean section, RH incompatibility, diabetes mellitus, or IUGR. So all these previous complication, if there is any previous complication, that is cesarean section, RH incompatibility, IUGR, or diabetes mellitus, one should perform the ultrasound in the first trimester pregnancy. Sometimes there may be to clarify the size, to clarify the date and size discrepancy. Date and size discrepancy. So there may be large 40 date fetus. Large 40 date fetus means if there is any abnormalities in the uterus, that is leiomyoma, congenital anomalies, congenital anomalies with pregnancy, leiomyoma with the pregnancy. So naturally, if there is any adnexal mass, ovarian cyst, multiple pregnancies, if there is multiple pregnancies, and if there is the patient may give you the wrong date, or there may be molar pregnancy. So all these things, if the early pregnancy, the size of the uterus will be more. With that, size of the uterus size of the uterus will be more. Size of the uterus will be more than the size of the uterus will be more than the height of the gestational age. So this with this, but only in case of first trimester pregnancy, only in the first trimester pregnancy we can calculate that, we can see exactly, we can see the gestational age. But all other the complication, all other the abnormalities we can detect. Sometimes the small 40 date fetus. Small 40 date fetus means if there is wrong date, if there is the blighted ovum, or missed abortion, brightened ovum or missed abortion, all these things can be calculated, can be seen by your ultrasound and be diagnosed by the ultrasound. So you are seeing that these are the all very, very important thing we can see in the first trimester pregnancy, and we can that is the indication. For that reason, it is very important to perform ultrasound in the first trimester pregnancy. In case of second trimester pregnancy also, we have to see, in second trimester pregnancy also, that is that sometimes the pregnancy with bleeding. So whether there is any placenta previa, placenta previa. For that reason, you will have to perform ultrasound, rule out the RH incompatibility, and the fetus hydros fetalis. For all these things develops in the second trimester, early second trimester pregnancy. So you will have to perform ultrasound in the second trimester pregnancy also. And sometimes the IUFD, suddenly there may be IUFD, and very early stage of the polyhydramnios also you can see in the second trimester pregnancy. In the third trimester pregnancy, most important thing is to detect the growth, that we perform the growth scan, that is to detect the IUGR, and of course IUFD, polyhydramnios, and fetal lung maturity. That is very important. Fetal lung maturity, you all know that is the respiratory distress syndrome. If the patient is delivered or by cesarean section early without any lung maturity, there may be lung fetal dysphagia. That if the lung is not matured, so there is respiratory distress syndrome. So this thing can be detected by ultrasound. So you are seeing that all these things can be detected, starting from the early pregnancy to third trimester pregnancy, that all these things can be detected by ultrasound. So our next part is the normal anatomical features, normal anatomical development or anatomical features of the first trimester pregnancy. First of all, I told you that 0 to 4 weeks, there is only some anatomical changes in the uterus. Uterus is slightly bulky and small amount of fluid is seen in that within the uterine cavity. But then we get the gestational sac. About 4 to 5 weeks, we get the gestational sac, and we get the gestational sac with an ecogenic border, that is called decidual reaction. With the ecogenic border, that is called decidual reaction. Then it is approximately, the gestational sac is approximately one-fourth of the size of the uterus. Then after that, 4 to 5 to 6 weeks, we get the yolk sac. Within the gestational sac, which is a confirmatory evidence of the pregnancy, and it is about, then the gestational sac naturally occupies about 1/3. I mean, the 6 weeks of gestational age, the gestational sac occupies about the 1/3 of the uterus, and then we get first we get the yolk sac, then we get the fetal pole. So fetal pole, first we get the fetal pole, then we get the fetal cardiac pulsation. 7 to 8 weeks, 6 to 7 weeks, we get the cardiac pulsation. Initially I told you that in case of transvaginal ultrasound, we get little bit earlier. All these parameters will get little 1 week earlier. But in transabdominal ultrasound, it is little bit late, as because we are seeing from outside. If we go close to the embryo, we get the information is a little bit earlier. At 7 to 8 weeks, the gestational sac, the 7 to 8 weeks, the gestational sac is about half of the uterine cavity. It's about half of the uterine cavity. The gestational sac is about half of the uterine cavity. Then we get the fetal, not only the cardiac pulsation, but also the somatic movement. Then after the somatic movement, we get the fetal pole somatic movement, heart rate, all we get yolk sac, everything. So the milestone is gestational sac is 4 to 5 weeks. Gestational sac, then fetal pole is 5 to 6 weeks, and then the cardiac pulsation is 6 to 7 weeks. Then somatic movement is 7 to 8 weeks, and then the placenta is from 10 to 12 weeks. We get the placenta, and we get the placenta. Yolk sac remains from 8 to 11 weeks, and when the placenta develops, naturally the yolk sac disappears. So this is the normal development. This is the normal development of the fetus in case of first trimester pregnancy. In case of first trimester pregnancy, if you don't get cardiac pulsation at 6 to 7 weeks, so in that case you may have to perform the transvaginal ultrasound to come very closely you can see. So the next part is your abnormalities in the first trimester pregnancy. That is very important, and because the obstetrician mainly depend on us, and because in the first trimester pregnancy they cannot by clinical examination they can't understand whether the embryo is living or dead. They cannot understand. Only by ultrasound we can see the embryo. First thing is a threatened abortion, particularly when there is the decidua, there is the early pregnancy bleeding. In case of early pregnancy bleeding, there are some decidual separation. The decidua is separated from the uterine wall. So there is some bleeding in between the decidua and the uterine wall. There is some blood clot, and there is bleeding. So the embryo gets late blood circulation, and the cardiac pulsation becomes bradycardia. So normally in case of very early stage, when the heart beats, it is 60 to 120 beats per minute. Then gradually it increases up to 170. Then again it decreases and it comes down to 160. So naturally, if there is any bleeding, early bleeding, the pulse rate or heart rate it reduces. So there is relative bradycardia. So bleeding, and there is some subchorionic hemorrhage with bradycardia, we call threatened abortion. So if the bleeding increases, the embryo may demise, or if it stops, the embryo may come to normal again. So this is a very important condition in case of early bleeding, that is called impending abortion or threatened abortion. Next is your within 8 weeks. This is very early stage, within 6 to 8 weeks. But if within 8 weeks, there may be the gestational sac. The embryonic gestational sac means there is no fetal pole. Within 8 weeks, if there is no fetal pole, only the empty gestational sac, we say that is a case of blighted ovum. That is a case of blighted ovum. So that is the second important condition we get in the early pregnancy, that within early pregnancy with 8 weeks gestational age, The sac is about 8 weeks size, 25 millimeter diameter. The sac is about 8 weeks size, 25 millimeter diameter. But there is no embryo or fetal pole. No embryo or fetal pole. That is called blighted ovum. That is, we don't know, this is a mysterious, due to some mysterious reason. Due to some mysterious reason, the gestational sac, the embryo is not there. So there may be some congenital anomalies or other things. The nature don't want that pregnancy should come up. Next is sometimes there is within the 8 weeks. Within 8 weeks we get the fetal pole. We get the fetal pole in early stage. At 6 to 7 weeks we get the cardiac pulsation also. We get the fetal pole, but there is no cardiac pulsation. If there is no cardiac pulsation, so naturally what we say, that is called missed abortion. So first of all, threatened abortion or impending abortion. Impending abortion. Number 2 is blighted ovum, and number 3 is missed abortion. Number 3 is missed abortion. That is also very important, missed abortion. And next is sometime due to the vigorous contraction of the uterine cavity, the fetus may, some portion of the sac or fetus may expel. Some may remain within the uterus. So what is called incomplete abortion. So some echogenic substances remain within the uterine cavity. So that is called echogenic abortion. That is called incomplete abortion. So these 4 types of condition we may come across during the pregnancy, abnormal pregnancy. But there are other condition also in case of abnormal pregnancy. What I have already mentioned, that the ectopic pregnancy is a very, very dangerous condition. In case of first trimester pregnancy, there may be ectopic pregnancy even diagnosed within 8 weeks. If you can't see that pregnancy test is positive, but if you can't see the embryo within the embryo or gestational sac within the uterine cavity, but you can see in the adnexal region, you can see the gestational sac. Sometimes you can see the viable embryo in the sac, in the outside the sac, in the adnexal region. So ectopic pregnancy can be detected. Sometimes there will be old ectopic pregnancy or living ectopic pregnancy also. That can be seen. Next is after the ectopic pregnancy, there will be heterozygous pregnancy. That pregnancy within the uterus, and one pregnancy is within the uterus, another pregnancy is outside the uterus. So heterozygous pregnancy also, though it is a very rare, about 30,000 cases, one in 30,000 cases we can get the heterozygous pregnancy. Now another thing, twin pregnancy is also very important, doctor. Twin pregnancy, that is also diagnosed in case of first trimester pregnancy. The twin pregnancy is also important. Sometimes the molar pregnancy is also very important. Molar pregnancy, there is a hydroniform mole that can be seen in the early pregnancy. You can't see the gestational sac, that is only there is a tropoplastic disease. The molar is nothing but a tropoplastic disease. It looks like incomplete abortion. And we get that is the molar pregnancy. Sometimes, doctor, we get the pregnancy with intrauterine, with IUCD. IUCD with the pregnancy, we can see the IUCD with the pregnancy. The IUCD is it is near the cervix. The IUCD, intrauterine contraceptive device, goes down, and you get goes down, and there is pregnancy. So it also very important to diagnose the intrauterine pregnancy with IUCD. And if the IUCD involves the lower part of the sac, and if it is contact the placenta, then there will be chance of abortion. So then the ovarian abnormalities already I have discussed in the case of your indication. So there may be large ovarian cyst, ovarian tumor, multicystic ovary. All these things can be seen in case of first trimester pregnancy. But even multicystic ovary or polycystic ovary also may in the patient they can conceive, and we can get the pregnancy, first trimester pregnancy. And in the case of first trimester pregnancy. So doctor, you see there are all these things that the abnormal pregnancy, we can get this abnormal pregnancy during your first trimester pregnancy. So you are seeing the importance of this first trimester pregnancy, and the importance of examination ultrasound in the first trimester pregnancy is most important. Not even in the last third trimester pregnancy, the first trimester pregnancy ultrasound is the most important. So don't miss the first trimester pregnancy ultrasound. It's very important and very informative also. It's very informative also in the first trimester pregnancy, and on the other hand, the most of the gynecologists or all the obstetricians, they are in dark. They are in the dark about the first trimester pregnancy, and then I'll go on discussing this other condition also, particularly the role of the ultrasound in the second and third trimester pregnancy. I will discuss with you, and particularly the attachment of the placenta and the placenta previa, placenta increta, all these things will be discussed in next classes. So I hope that I have been able to explain you the role of the first trimester pregnancy and role of ultrasound, and what is the essential requirement for the gynecologist that I have discussed. So now the question answer session. So if you have any question, actually we have to finish this discussion or this online class within 1 hour. So already I have discussed about 45 minutes. Another 15 minutes I keep, or another 15 minutes for your question answer session. So if you have any question, you better write it down, and I will answer your question one by one. Write down the question in that. তোমাকে জিজ্ঞেস করতে কিভাবে question করবে? Write down the question. হ্যাঁ, আপনি বলে দিন তো। হ্যাঁ? Inbox. In the inbox you write down the question, and question I will give you. You write down the question and we will give you the answer. Now the question answer session. দেখো কি question is. আমি দেখুন question আসছে। এইখানে এসো, কি বলছে দেখো, একজন এসেছিল, আসছে।
Good evening, sir. Hello.
ঠিক আছে, দুবাইতে আসুক, একটু দেখছি কিছু আছে।
এখানে দেখো, এটা দেখো তো।
Chart to everyone. No. It is sir. Whether also it is the inbox. Chat box type inbox.
That okay.
Asking. Asking is that it's asking.
কোনো কোশ্চেন আসেনি?
না
হ্যাঁ?
না স্যার। আপনি এখনো অন আছে স্যার ডাক্তার, আমি তো বলে বলতে।
So our next on Monday, doctor, on Monday all of you come to our at 5:30. We'll discuss on placenta and amniotic fluid. On Monday we'll discuss on amniotic fluid and placenta. This is very important thing. We always concentrate on fetus, but when you perform the ultrasound, you'll have to concentrate on placenta and amniotic fluid also. So from on Monday and Saturday, the same thing will be discussed, and I request you, doctor, if you come to our class, I will be very glad. So that interaction, then to কোনো question এসছে না। হ্যাঁ? করে দিয়েছো না? So next, so we are particularly on Monday we are starting the placenta and the amniotic fluid. So I hope all of you attend, and those who are stay close to our center. So I will request them to come hard so that in front I can show you the plates also. But in ultrasound, কোনো question এসছে?
না করছে না যে ডক্টর ঝা নেপাল থেকে প্রেজেন্টেশন দেয়।
চ্যাট বক্স থেকে ইনবক্স।
হ্যাঁ?
যখন মুখে যাও নেপালে ওটাই এসেছে।
Yes.
না
We can see the presentation.
হ্যাঁ?
Presentation দেখতে চাই। পিপিটি করে যদি দেখাও স্লাইড
এক্সরে কি দেখানো যাবে? প্লেট দেখানো যাবে?
ক্যামেরার সামনে দেখাও।
কোন ক্যামেরার সামনে?
এই ক্যামেরার সামনে আমরা প্রথমে আগে থেকে ওটা স্ক্যান করে তুলে রেখে ওটা দেখুন কাম করতে শেয়ার করতে।
Dr. Jha, actually, we are arranging. We will arrange to show you the plate. To show you the plates, I will show you the time to show you the plate. So there is no, as there is no question, as there is no question, so I am just closing this session, closing today's session, as there is no question, and because you are not here, so I cannot show you the plates. So next time I will try to show you the plates next time, and we have to arrange some other technical aspect, and we will show you the plates. So today I end it here. So if you have any sort of discussion or anything, you can call me, of course, over phone. You can call me over phone also. I can keep in touch with you. I'm glad that today about 15 students attended this session. I'm glad. So every Monday and Saturday you try to attend this class. Okay, thank you all. Now close for the.
Thank you, sir.
Thank you, sir. Thank you, sir.
ঠিক আছে। আপনার এটা খুলুন।
শুনে যাচ্ছিল?
না অনেক ডাক্তাররা বলছে যাদের নাকি শোনা যাচ্ছে না, ওটা অল ওভার ইন্টারনেট করে।
হ্যাঁ?
মোবাইলে আমি দেখো দেখে বলুন যে কথা কি বলছে। অনেক ডাক্তাররা বলছে যে তাদের শুনতে পারা যাচ্ছে না, ওগুলো অল ওভার ইন্টারনেট করে কথা বলতে। বলে ডক্টরদের আগে
ওখানে ডাকো। আমার টেলিফোনটা দাও তো। তুমি ক্লাসটা করো। হ্যাঁ? এই স্পিতা তুমি ছেলেদের বলে দাও যে যারা যারা কাছাকাছি থাকে তারা যেন আসে। আপনারা যারা কাছে থাকবেন তাহলে আমি এখানে প্লেটগুলো দেখা দেবো, প্লেটগুলো দেখা দেবো। সোমবার 5:30
ওটা আবার সেভ করতে হবে।
ওটা পাঠা দেবো। একে নিয়েছে, বিজেন ভাইকে নিয়েছে।
বিজেন ভাই আছে।
হ্যাঁ,
বিজেন ভাইকে তো নিয়ে যাবে, মিতালি যখন যাবে।
মিতালি কোথায়?
মিতালি বেরিয়ে গেছে। হ্যাঁ বেরিয়ে গেছে, তাহলে বিজেন
ভাইকে নিয়েছে।
বিজেন ভাইকে নিয়েছে তো। হ্যাঁ নেক্সট দিন থেকে না স্যার প্লেটগুলো দেখাতে হবে।
সেটাই কিভাবে দেখাবে, ডুবে আসুক।
স্ক্যান করে ঢুকিয়ে দিতে হবে। পেন ড্রাইভ থেকে ঢুকিয়ে দিতে হবে।
হ্যাঁ, আমারগুলো হয়েছে। এই যে তুমি কটা বন্ধু আছো? ঠিক আছে, আমি যাবো। শোনো না, প্রথম কথা তো অনেকে বলছি কিনা শুনতে পাইনি।
আমার বড়
হ্যাঁ, না না, আমারটা এখন আমি শেষ করে দিয়েছি।
অনলাইন রয়েছে তো এখন স্টুডেন্ট আছে, ওদেরকে বলো তো অনলাইন দেখা যাচ্ছে।
হ্যাঁ হ্যাঁ,
অনেকেই তো অনলাইনেও বসে রয়েছে,
আমি তো এড করে দিলাম তো।
অনেকেই তো অনলাইনে রয়েছে।
And next class will be on Doctor, can you hear me? Please write down in your,
Yes, sir. Yes, sir. Yes, sir.
chat box. Can you hear me? Some of your students, they told me they could not hear my voice. So
Yes, sir.
the early stage of
আমরা তো শুনতে পাচ্ছি তো।
program. So some of the
দাদাকে ফোন করুন তো।
so
Yes, sir.
the next class will be on Monday at 5:30. But I request you to come here so that I can show you the plate also. Please come. Those who stay close to our center, I request them to come. Okay?
Okay, sir.
And today, if you have any question, you can ask me the question.
Sir, normal.
Audible. সবাই তো তাই দিবে।
Audible?
Sir, can you hear me?
हेलो
Sir, can you hear me?
आपका सुनाई दे रहा
Hello?
है क्या?
Hello.
শোনো না, বলছিলাম যে প্লেট গুলো কি করে দেখানো যায়?
এগুলো তুমি সামনে
अच्छा सुनिए बात कीजिए।
हेलो,
Sir, I'm Toru.
हाँ, आपका जो Zoom वाला
Sir,
ऐप है
can
ना,
you hear me?
उसका नीचे देखिए एक ऑप्शन आ रहा है कॉल ओवर इंटरनेट।
Hello.
उसको क्लिक कीजिए कॉल ओवर इंटरनेट को, तब आपका वॉइस आएगा। और आप एक बार डिस्कनेक्ट करके कनेक्ट कीजिए।
Doctor, now can you hear me? Dr. Jadov,
Yeah.
can you hear me? Hello?
Hello. Sir, your voice is clear.
So next class we are trying to show you the plates, X-ray plates. And I expect
Okay,
some
thank you, sir.
question. I expect some question from you. If you have any question, so we keep some time for question answer session. So you can ask, you can send some question also.
Doctor, নেই বাবা, আচ্ছা ওটা ফিক্স ছিল। ওকে ওকে,
আরে accepted মধ্যে দাও তো, accepted।
দেখা না অপরে নাকি যতক্ষণ ক্লাস চলে।
আরে এমনি দাও তো, কিভাবে দেখাই দিচ্ছি। একটা এগুন একটা স্টুডেন্ট দাও।
ওনার তো আসি
হ্যালো হ্যালো, ওই জুমের লিঙ্কটা ক্লিক করেছিলেন? আপনার মোবাইলে জুমের অ্যাপ্লিকেশনটা ডাউনলোড করা আছে? জুম হ্যাঁ, জুমের অ্যাপ্লিকেশনটা ডাউনলোড করতে হবে জুমের মিটিং এ। ওটা আপনি প্লে স্টোরে যান, প্লে স্টোরে গিয়ে জুম বলে আপনি করুন, ডাউনলোড সার্চ মারুন, তখন ডাউনলোড ZOO। হ্যাঁ হ্যাঁ হ্যাঁ, এবার এই ওটা ডাউনলোড করার পরে যে মিটিং আইডিটা আমাদের দেওয়া হবে, মিটিং আইডিটাতে ক্লিক করবেন। তাহলে আপনি
এই মিটিং আইডিটা দিয়ে দাও ওনাকে। মিটিং আইডি দেওয়া আছে?
কবে দিয়ে দিয়েছে?
আচ্ছা এই পেজটা যদি আমি দেখাতে যাই কিভাবে দেখাবো?
ওটা কোন বিষয় নিয়ে হচ্ছে?
হ্যাঁ, ভিউ বক্সে দেখালে কি দেখা যাবে?
দেখো সামনে প্লেটটা তোলো। হ্যাঁ, এখানটা দেখাতে হবে, তাহলে ক্যামেরা দেখতে ক্লিয়ার দেখতে পাবেন। পিছনে তোমার লাইটিং, লাইটটা একটুখানি ঘুরিয়ে দাও, তাহলে লাইটটা পড়বে। দেখতে হবে প্লেটটা তোলো, দেখতে হবে।
এদের দেখানো খুব মুশকিল।
তাহলে তোমাকে লাইট পজিশনে দেখাতে হবে।
হ্যাঁ,
ভিউ বক্সেই দেখেন।
ভিউ বক্সে যদি আমরা দেখেন,
দেখো না, ওটাকে ঘুরিয়ে দিচ্ছি ক্যামেরাটা।
ভিউ বক্সই দেখেন খুলে দাও। ভিউ বক্স কি করে দেখা? হ্যাঁ, দেখতে দাও। ভালো শুনতে পেয়েছি বলো?
শুনতে পেরেছে জিজ্ঞাসা করো।
শুনতে পেয়েছেন? আর নেক্সট মানডে আমাদের 5:30 সিলিন্ডার আছে, আপনারা যারা যারা কাছে থাকেন তাদের খেয়াল করতে এখানে এসে ক্লাসটা করবেন।
হ্যালো হ্যালো,
বোঝাবে?
হ্যাঁ, ভিউ বক্সে যাচ্ছে।
কানাডা আছে স্যার? কানাডা
হ্যাঁ,
দেখতে হবে না।
তাহলে নামিয়ে দেবো বাইরে খুলে চেয়ার। এই যে এইটা সাহায্য, এইটা এখন বন্ধ কর, এইটার ভেতর ঢুকিয়ে
হ্যাঁ,
এটা তোমাকে দিয়ে দিই।
বাহ বাহ, হ্যাঁ বাহ, আমি এখানে কি বলতে পারি?
আপনি এইটার মধ্যে যেরকম দেখান ওইটার মধ্যে
হ্যাঁ, এই তো Doctor,
Hello.
next day onwards, after the class, I will show you the plate. Can you see the plate? Please answer in your. Can you see the image of the plate? Please answer in your
Chat box.
chattering box or anything. You can answer, please. Yes or no. জিজ্ঞেস করো, এই স্মিতাকে বলো জিজ্ঞেস করতে যে দেখতে পাচ্ছি না। স্মিতাকে জিজ্ঞেস করো না, তাও বলু। আরে যে কোনো একজনকে অন্তত করুক না।
মাইক্রোফোন লাগবে একটা, নয়তো অসুবিধা হচ্ছে। আমরা
Hello.
হ্যাঁ,
Hello, sir.
মাইকে কথা বলি, তোমার হেডফোন।
Can you hear me? Hello. Hello.
তুমি শুনতেও পারো, বলতেও পারো। তুমি ওদের ফিডব্যাকটা শুনতে পারো।
এই অর্ঘকে যে মানে দিয়েছি কানে লাগানোর,
তুলে দাও, এবার বলো।
কি করে পড়ে গেল?
Hello, doctor, can you see the plate?
Yes, sir.
You can see the plate.
Sir, plate is seeing but not clear.
Okay. So at least this is you see, this is a plate of cervical swell. Can you see now? Is it good?
Sir, this is
the cervical swell. You see, this is cervical swell. Can you see this cervical swell? This is the longitudinal
Yes, sir.
scan of the uterus.
uterus longitudinal section. There is a swell.
This is the
Yes, sir.
swell. This one is the swell. This
Yes,
is
sir,
the
yes, sir.
swell. This is enlarged view. তুমি একটা fix করে রাখো না।
Enlarged view. Last one is enlarged view, sir.
So this is your swell in the cervix.
Yes,
Is
sir.
it clear to you, doctor?
Yes, sir.
So in that way, I will next class after the class, don't leave the online class, but I will show you some plates in the next class onwards.
Okay, sir. Thank you.
Okay.
Yes, sir.
Okay, please tell all of your friends. Please tell all of your friends that we will show you the plates in the next class.
Okay, sir.
Okay, thank you, doctor. Thank you. ঠিক আছে, ওরা শুনতে পাচ্ছে। এই সিস্টেম গুলি দেখো না।
তুই তো দেখছিস জয়েন কর একটা চোর মারবো। ঠিক আছে।
মিটিং লিভ করে দিচ্ছি।
হ্যাঁ, মিটিং লিভ করে দাও। আর তোমার নেক্সট ক্লাসে আমরা সব ঠিকঠাক করে দাও। নেক্সট ক্লাসে ফিল্ম 20টা ফিল্ম দেবে। এই 10টা 20টা ফিল্ম দেবে।
তুইটা দেখাতে পারবেন স্যার এরকম করে?
অসুবিধা কি আছে?
10টাই করুন না।
আচ্ছা, দিয়ে 10টা। ভালোই তো হয়েছে, কিন্তু
এখনো কিছু অনলাইন হয়ে রয়েছে।
ঠিক আছে, হাতে ক্লাস।
বাইরের অনেক ক্লাস করতে পারবে, মাত্র দেখবেন পাসওয়ার্ড
হ্যাঁ, সে ঠিক আছে।